Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zia. I welcome all undergraduate and postgraduate medical students for the lecture of thyroid gland. In the first lecture of thyroid gland, we will discuss the anatomy, and then in the subsequent second and third lecture, we will discuss the physiology and pathology of thyroid gland. So, we will start with the anatomy of the thyroid gland. Thyroid gland is an H-shaped gland in front of the neck. It has left and right lobes which lie on either side of the inferior part of larynx and superior part of the trachea. It extends from the middle of the thyroid cartilage to the level of the sixth tracheal cartilage, while the isthmus overlies second to fourth tracheal rings. Pyramidal lobe is sometimes present, and in cases in which it is present, it arises from the isthmus. Coverings of the thyroid gland. Thyroid gland has a false capsule and a true capsule. False capsule is a sheath of pretracheal fascia which is attached to the arch of the thyroid and thyroid cartilages to form the suspensory ligament of thyroid gland. This suspensory ligament of thyroid gland moves the thyroid gland with the larynx during the process of swallowing, and also it causes the oscillation of thyroid gland during the speaking. While the true capsule is a fibrous capsule. There is a space between the sheath and capsule of the thyroid gland which contains the loose connective tissue, vessels, nerves and parathyroid gland. As far as relations of the thyroid gland is concerned, anteriorly it is related to the skin, superficial fascia, intestine layer, infrahyoid muscle and pretracheal fascia, while the posterior-medially there is larynx and trachea, pharynx and esophagus and recurrent laryngeal nerve. Posterolaterally it is associated with the carotid sheath containing the common carotid artery, an internal jugular vein and vagus nerve, and the cervical sympathetic trunk. Now the blood supply of the thyroid gland. Thyroid gland is supplied by the superior thyroid artery, inferior thyroid artery, and in some cases the thyroid ima artery. Superior thyroid artery. Superior thyroid artery is a branch of the external carotid artery. It runs superficial and parallel to the external branch of the superior laryngeal nerve to reach the upper pole of the thyroid gland. It gives off superior laryngeal artery in company with the internal branch of the superior laryngeal nerve, while the inferior thyroid artery is a branch of the thyrocervical trunk of the subclavian artery. It turns medially and downward and reaches the posterior border of the thyroid gland, where it is closely related to the recurrent laryngeal nerve. Inferior thyroid artery supplies the inferior pole of the thyroid gland. The lowest thyroid artery, which is also called the thyroid ima artery, it is an embryonic artery and it occurs because of the failure of the vessel to close and remain patent. The artery has a variable origin. It mostly arises from the brachiocephalic trunk, but may also originate from the aortic arch, right common carotid artery, the subclavian artery, pericardiophrenik artery, thyrocervical trunk, the transverse scapular artery, or the internal thoracic artery. And after its origin, it ascends in front of the trachea in the superior mediastinum to the lower part of the thyroid gland. Next is the nerve supply of the thyroid gland. The thyroid gland receives sympathetic nerve supply from the superior, middle, and inferior cervical ganglion of the sympathetic trunk. The gland receives the parasympathetic nerve supply from the superior laryngeal nerve and the recurrent laryngeal nerve. Superior laryngeal nerve. It arises from the vagus nerve. It has two branches, internal branch and external branch. Internal branch pierces the thyroid membrane to innervate the mucous membrane of the larynx above the fissure of the glottis, while the external branch descends in company with the superior thyroid artery and supplies the cretothyroid muscle. Next nerve is the recurrent laryngeal nerve. Recurrent laryngeal nerve arises from the vagus nerve and hooks aortic arch on the left side or the subclavian artery on the right side, and then it ascends in tracheoesophageal groove. Recurrent laryngeal nerve passes deep to the lobe of the thyroid gland and comes into close relationship with the inferior thyroid artery. It crosses either in front or behind the artery or passes between the branches. Nerves at its termination enter into the larynx posterior to the cretothyroid joint, which is now called as the inferior laryngeal nerve. The innervation of recurrent laryngeal nerve include laryngeal mucosa below the fissure of the glottis, all the laryngeal muscles except the cretothyroid, which is supplied by the superior laryngeal nerve. This is the diagram which is summarizing the blood supply and the nerve supply of the thyroid gland. You can notice that the nerves accompany the arterial supply. The arterial supply is via the superior thyroid artery, inferior thyroid artery, and the lowest thyroid artery, that is the thyroidea ima artery. And the nerve supply is via the right and left recurrent laryngeal nerve and the external laryngeal nerve. Venous drainage of the thyroid gland. Thyroid gland is drained by the superior thyroid vein, middle thyroid vein, and the inferior thyroid vein. Superior thyroid vein drain into the internal jugular vein. Middle thyroid veins drains into the internal jugular vein, while the inferior thyroid veins of the two sides anastomose with one another as they descend in front of the trachea to form the unpaired thyroid venous plexus, and this thyroid venous plexus then drains into the brachiocephalic veins. This is the diagram which is showing the venous drainage of the thyroid gland. You can notice here that the superior thyroid vein is draining into the internal jugular vein at the right upper side of the diagram, while the inferior thyroid vein forming a plexus and draining into the brachiocephalic vein. And the middle thyroid vein is also directly draining into the internal jugular vein on both sides. That's all.